Welcome to another episode of the Outlier Room. This episode especially is one of my most favorite episodes. Reason being, this episode is going to be more focused on the most critical and crucial topic of today's time, women empowerment. I'm really glad to have someone with me today who has not only embodied the spirit of true women empowerment, but has also been a leading administrator in the hospital sector. And then she has led quite a few reforms as a Rotarian and now as a district governor elect for 2025-26 for RID 3080. I'm really glad to welcome Dr. Rita Kalra with us today.
Thank you, Dr. Nitya.
Thank you so much, ma'am. Ma'am, you have had a very fantastic career as a hospital administrator. Then you have worked as a Rotarian. You have been involved in quite a few leading projects throughout your journey. Now, we want to know how has your journey been so far? And we want to know from you how you have evolved from someone who has only been a part of the process and now you are leading them.
Thank you, Nitya. This is a wonderful question. So I would like to tell you, this journey, especially for a woman, depends upon the family and the outside environment. So right from the beginning, being the eldest daughter of my parents, and we are three sisters actually. So I would say the strength I derive is from my brought up. So we were brought up together in Bhilai, and that is the steel city.
Yeah.
And they never thought that they had three girls and what they will do, they just have to be married off. But they worked to make us economically independent. So like we were rushing from one hobby class to other. It would be painting, then Bharatnatyam dance, then music, and then studying also, like excelling, being the number one in the class that way. So after that was from childhood till adolescence. So after my marriage, I got the similar environment at home, like especially full support from my husband, and then children, of course, who let me believe in my strength and continue to work in healthcare. And my in-laws were also very supportive. So I say that women have to derive the strength from the family and the environment. Then only they are able to reach to this level.
Ma'am, with this, I have a question because since you are one of the leading administrators in a government hospital, ma'am, you have seen the public healthcare system. There are a lot of challenges that we as citizens see, but you as an administrator, you see it. And especially looking at it from the lens of a woman, there are even more challenges that they face. So how do you describe that, those challenges, especially the women face in terms of the basic necessity like healthcare not being provided to them?
Yeah, I'll tell you, even working in a hospital, government sector, we find that there are more women because nursing care is totally women, then paramedical, lots of them, and 50% of the doctors are like women in public health sector. So not only we need to take care of ourselves before we take care of the population. So I would find that they would never go for regular annual checkups or the screening campaigns. And by 30, 35, because of so much of anxiety and stress, they land up with blood pressure and other non-communicable diseases. And it is very disappointing because they don't go for screening. I have seen some of them, like 5%, I would say, would land up in cancer. So that's how I started this campaign of not only the annual confidential report of how they work, but also annual health report. So that's where we got screenings done and identified. Even a simple disease like anemia was also prevalent because they didn't care about the nutrition or but for own self. But I believe that if we are not taking care of women's health, we are actually making it an economic burden not only on the society but country as well. So for the family also. So it is the woman health is very important. And another startling fact which I found was this PCOD, polycystic ovarian disease, endometriosis. It might be existing, but it has been on a rise because of our sedentary lifestyle, especially in adolescents. So that these diseases are unresearched, undiagnosed, even misdiagnosed, leading to complications, and they are not treated properly on time, so it can even lead to death. So this is a huge lacuna. Like there are diseases, there are women, but women's health and women's life has to be very important. That there are treatments also available for these diseases.
Yeah.
So I have been advocating for cervical cancer, which is like 20% prevalent, especially in low and middle income countries like our country. And the vaccine, because this cancer can be prevented by a vaccine, but it was not adopted in universal program until 28th of February 2026. Now it is a part of this, but Rotary spearheaded this campaign in the entire country and few other countries like Africa, Egypt, where with the help of funding from grants and philanthropists, we were just covering, say, 10,000 girls every year, giving them vaccination. But because of lack of awareness, no sensitization about the importance of this cancer, and this vaccine, I would say, is like an insurance. You are saved of all the trauma you have to go through if you suffer from this disease. So I feel that it has been totally revolutionized our healthcare. We are really grateful to our Prime Minister Narendra Modi ji, who has got this into the universal immunization.
That's brilliant, and I think as a Rotarian under your leadership, I have learned a lot of these things which I was not even aware of. So whenever I meet a lot of people these days, I educate them on those fronts also. And that was the first time when I came to know that cervical cancers, the medicine, even the injections are available. I was not even aware. So thank you so much for enlightening us with that, ma'am. Ma'am, you have seen as a senior leader in the industry, both policy formation and the ground level execution as well. But there is a big gap that still exists. What do you have to say about it?
See, I say the government has made wonderful national programs and the policies, and there are systems to be implemented right from top level at the nation to state to district and finally, I would say the smallest unit, the sub-center. But the motivation has been low down there. It is improving, and I believe that execution is the main problem. Otherwise, these diseases, I would say, would not have become an epidemic like it is growing.
Correct. Correct. Ma'am, specifically, I want to talk about you have led some very big initiatives like Artha, Ma, Hunar, and these are mainly focused on women. And because even coming up with one such initiative, people do it in their entire lifetime, and you have done 3 to 4 of them, and then in the next year of Rotary where you will be leading, you have a lot of plans for that. So, what has been the vision behind executing such large-scale projects?
See, we talk of women empowerment. So I believe it is a process of lifting other women, sharing the opportunities and the power we have, and finally getting all of them along with their inner strength. That is women empowerment. So it could not be just limited to one area of focus. So that is why health was my forte. That is how the project MA came up, which is mother and child health basically. So we focus on nutrition. We also focus on this Garbh Sanskar, so that the progeny is better. It is on a small scale, but we are trying to implement it through stories and a workshop for antenatal women who come to the hospitals. And then the nutrition supplements, then vaccination and Anganwadi upgradation so that child health can be improved. So this was health. Then, which I was actually doing in my workspace. Then I definitely felt that without education, nothing will change. So that is why we were promoting scholarships and vocational skilling so that they are economically independent. So whenever we would draft the curriculum, we would like to motivate girls who were dropouts or who were being forced to get married and get them into this work so that they earn and support their families. So there was this girl from the rural slum area, and her father was suffering from hemiplegia, like after stroke.
Yeah.
So he was bedridden.
Okay.
So we had launched this program of home care nurse. So she needed to support her family because her father could not do it. And she wanted to take care of her father.
Wow.
So that's how she came for this home care nursing program, which we do it with this Chandigarh administration, social welfare at Asha Kiran. So we started in 2017. It was a tough route because getting approvals from the government, approving the curriculum, but we managed to do it finally. And almost every year, about 150, 200 girls graduate in this program. The course is totally free. We provide them the entire kit, curriculum, and even the training is done at government hospital. So once she learned it, she started taking care of her father, who slightly improved. But then with her skill, she got more jobs. And now she is working in a nursing home, actually corporate hospital. So earning about 35,000 as a home care nurse.
Wow.
So like she's an inspiration. This is just one example, but I believe 50% of the girls, because they get married, they mobilize from the place where they work. So then the employment drops actually. But still this program is helping a lot, and there are many other vocational skilling programs. We call it Hunar. So that is like skilling people. And the third one is Sudiksha, where we talk about moral values and other mental wellness exercises. So that really strengthens the woman's soul and their performance.
Wow, this is, I think, when you actually see these real life stories, I think that inspires you to do better.
Yeah.
Ma'am, with that, I want to ask you another question, and I think because this year is going to be your year where you will be working as a district governor, taking care of one of the biggest districts, and I would say the most dynamic district across India. Ma'am, what are your plans, especially for women empowerment? What are your thoughts on that?
See, leadership is not about taking charge. It is taking care of those in your charge. So about 4,500 total Rotarians in our district in 6 states. There are just 612 women. So if we want to support the women empowerment, we need to strengthen ourselves. So my first focus is to just double this membership so that we are close to the world goal of 30%. We will be around 20% if we just double this membership. And after that, we want to work for the community. So there are lots of coordinators from these 5 states, and they're sharing experiences. We will be working on environment wellness, then of course skilling, then POSH Act and POSPO, because for women's security, they know their rights and privileges basically. And finally, we are also working on digital safety measures. So we are trying to mentor the two generations. Like the youth would need moral values, ethics in their lives to finally a steady success.
Correct.
So that can come from the elderly population. And elderly, they are afraid of technology. So we want these youth to mentor the adults with new technology. And as we have discussed, with your organization, we would be signing MOU for artificial intelligence, literacy, mind wellness, and leadership. So I believe that way we will be mutually empowering each other, because women empowerment is not just about women.
Absolutely.
Because men, it affects the men also.
Yes.
So we have to move around in such a way that women are also empowered and their challenges are taken care of, and the men are also comfortable.
Absolutely.
Together, to work together.
Absolutely. Ma'am, in fact, I want to tell you, we have almost 50% of our employees in the organization who are women. And in fact, the chairperson of our entire group is a lady, who is now the councillor of Canterbury in New Zealand, Miss Natas Lemon, who has earned a reputation for herself in the domain by working extensively for people and childcare and other aspects of society. So really glad that you mentioned that. Ma'am, I mean, there is this element of very important element which is connected to empowerment. It is financial independence as well as dignity of labor. How do you see that in women?
See, because finance is very important. That way they are able to take decisions themselves. When they take decisions, then they are able to access to all the services or all the facilities available. So that is why I believe everyone should have a vocational skill so that they can earn for themselves. It could be building a startup, transforming education, reinventing healthcare, or even strengthening a social, I would say activism is also a profession. So, and everything needs money.
Yeah.
So that is why if they are financially independent, so they will be able to take decisions and then not only empower themselves, but the community.
Absolutely. So, ma'am, I mean, since Rotary is one of those organizations, and being a Rotarian, I would say that at the time of pandemic, Prime Minister, when in his speech, when he reached out to the world, especially Indians, he spoke about Rotary as well to help them. So Rotary has always played a very important role for national interest as well. And this district plays a very important role because Chandigarh is considered a cosmopolitan city, which actually decides the fate of how we see tier 2, tier 3, and even tier 1 cities. How do you think, Rotary as an organization is accelerating the growth and the vision of country at large?
Yeah, I would say like it is the largest NGO. So we are a huge network of members across the country. Like we are about 2 lakh Rotarians in about more than 4,000 clubs and 45 districts. So what I see is all the NGOs collaborating and working together with the local leaders as well as the government, because they make every project scalable and sustainable. That is how Rotary is working. It is not about duplicating. So we integrate with or partner with the government and other NGOs. So that is how, because CSR is also coming to Rotary, so that it has built a trust and faith among the public that every penny will be accounted for and it will be used in public interest. So that is how Rotary is supporting the country. Otherwise, and the countries of the world, I would say, not only just India, because we are in more than 200 countries, and that is the main strength of Rotary. We saw it in polio, and we'll see it in all the challenges we accept.
Absolutely, absolutely. And for the world to know, polio is one of the biggest diseases that the world ever saw. And we as Rotarians are very proud that we have played a very important role in eradicating it from the world. So, ma'am, my other question to you is, because we are talking about women empowerment, Uh, what should leaders, especially the male leaders, should do differently to support women empowerment?
So the first thing is the dignity, no?
Yes.
So they have to respect. So that is what we call the mantra of this joint leadership is diversity, equity, and inclusion. So it is at every step that when you take decisions, first they should have a voice on the table, the women, and then they are able to take decisions independently, and they should trust them because they bring a different perspective to the table. And most important thing, they have clarity of thought, a courage to start, and conviction to finish. So which is the greatest strength of.
Wonderful, wonderful. Ma'am, my question is very specific now. If you had the power to implement one nationwide change, especially for women, what would that be?
So I would love that every woman has access to healthcare. And the other thing is all the universities out there are working or researching on improving healthcare.
Correct.
Those diseases which have not been, like I would say, not been touched, but they affect women's health.
Yeah.
So lots of research and every woman has access to health.
Wonderful, wonderful. I think if that will happen, I think we will be
Healthy nation, automatically.
absolutely. Because everything starts in a family with women, I think, and their health is extremely important. Ma'am, you have balanced leadership, service, personal life. What have been your greatest strengths, in your journey so far?
So I would say like first is resilience.
Yeah.
So I just don't lose hope any number of times. I would say whenever I have been faced with challenges, I bounce back. I don't stop. That is my biggest strength. And then I bring lots of positive energy. I don't carry the burden on my shoulders. So if something bad happens, I will just try to analyze and then find a way out, move forward, and just forget about it.
Wow.
So even if people have wronged me, they don't have to bother because I don't carry that grudge against them.
Wow.
That is my biggest strength.
Brilliant, brilliant, brilliant. Ma'am, there are a lot of women in the world, in our society today, and there are a lot of stigmas that hold them back from going. How do you think that those stigmas can be broken?
I think education is the best way. And not only educating women, educating the men and the families.
Yeah.
That they have to be strengthened because our country or our civilization in India, I would suggest they have the history knows how women have played a very important role.
Absolutely, absolutely. Those are words of wisdom, and really, really glad. Now comes the most one of my favorite parts of the podcast, in which we do the rapid fire. So we won't give you much time to think about the answer, though I'm very sure that you won't take much time. But there are 4 or 5 questions I want to ask, and I want to hear from you one word. What do you think about it? Empowerment in one word.
It is like a Wi-Fi password. Share it and get connected.
Brilliant. One barrier women must break today.
Break the glass ceiling with confidence.
Brilliant. Leadership quality that every woman should build.
Resilience. I would say recharge. You are not the batteries to be drained, but the power bank of the society.
Oh my God. Wow. This is going to be one of those clips that we'll be running. Brilliant. One message to society.
I would say that just don't take women for granted. They will adjust and they will, because there is no such button even in the washing machine. So just remove that mute button because we are ready to speak up for ourselves.
Brilliant. Last but not least, and the most important word, as a Rotarian, I want to know from you, what does Rotary mean?
I would say it is a world family without awkward relations. Because
Wow. Wow.
the entire Rotary is like a family too.
Brilliant. Ma'am, since you have played so many roles in your life and you have carved a reputation and a name for yourself in the society, and in our podcast, we talk to outliers who have made a position for themselves. What is that one message you have for our listeners and viewers today?
So I would like to conclude with a Sanskrit shloka, especially when Navaratras are around. Balika aham balika, navyug janita aham balika, naham bala durbala, adi shakti aham ambika.
Wow.
I am a girl who will cradle the new era, and I'm not weak, I'm strong, I'm record.
Brilliant, brilliant, brilliant. Ma'am, we have recorded so many people in this podcast, and this has been one of my favorites ones so far. And I want to mention this thing because I have worked very closely with Rita ma'am, and it has always been a pleasure. So we thought that our viewers and listeners, especially in India, in New Zealand, and other parts of the world, they will get a lot of benefit from this podcast today. And before I conclude this, I want to mention that there are very few people who are committed to what they say and turn their words into actions. And with Rita ma'am, we see it every single day when we work with her. So it has been a pleasure hosting her today. And we'll see you in the next episode of the Outlier Room. Thank you so much.
Thank you.